With the entire world struggling to adapt to the changes brought on by COVID-19, one subject that piqued our interest was the effect of the disease and how it affects menstrual cycles of women. And our research question explains how COVID-19 pandemic affects the menstrual cycles of women ages 30 to 35. One study that we looked at defined regularity as women after 2 years of menarche having at least 4 out of the 5 cycles being less than 35 days. The study also defined irregular cycles as being at least 4 out of the 5 cycles greater than 35 days in length or completely irregular in cycle length. One cohort study evaluating irregular menstrual cycles of about 2,400 women found that 500 of the women, which was about 24%, reported irregular cycles over follow-up intervals during 12 months. The authors observed that women who reported higher levels of depressive symptoms and perceived stress had a greater prevalence of irregular cycles. There is another study that found stress alters the length of the luteal phase, which presents obstacles for women trying to conceive. There's limited research evaluating the possible association in irregularities in menstrual cycles and COVID-19. Some of the gaps in research include the menstrual cycle changes based on different careers, diet, weight changes, and age groups. Studies may suggest that changes in the menstrual cycle, whether the days become longer or shorter, may result in negative fertility concerns. There's currently no published data on the effect of COVID-19 pandemic and menstrual cycles, but this presents a significant gap in research. In a previous study evaluated by the Korean population, they evaluated whether menstrual cycles are susceptible to changes in sleep patterns during the COVID-19 pandemic and included any racial background and ethnicities. Some studies, limited to certain professions, such as nurses and those who work rotating shifts, are limited, and there's no data available from past pandemics such as flu pandemic, SARS, and HIV/AIDS. We hope to expand the general knowledge for the COVID-19 pandemic. Our study population will include a random sample of 500 women living in the suburban Chicago area who have been tracking their cycle 2 months prior to the COVID-19. In order to qualify to be in the cohort study, the women must be 30 to 35 years of age, they are not currently taking any hormonal birth control, and they're not having taken any hormonal birth control in the past 6 months. So never previously having had a live birth or have been pregnant in the last 6 months, those women will not qualify to be a part of this study. And a previous miscarriage does not exclude women from the study, and retrospective data will be collected regarding menstrual cycles prior to the onset of the COVID-19 pandemic. This age group for our study was selected due to the research that we had done suggesting that many women are delaying childbirth until their 30s. This age group's more likely than to have awareness of their menstrual cycle as well, so they fit the criteria of never having given birth to a child. They may also be planning to have children in the near future, so capturing the menstrual irregularities due to a global pandemic will provide more important information for future family planning, especially during times of a global pandemic and instability. And in order to establish this baseline data, all of the participants must have been tracking their cycles prior to the study and be reporting their regular cycles if need. It is important to note that the terminology regular cycles is somewhat subjective and is unique to each participant. Random selection is most important in order to represent the population. The best way to do this is to gain access to census records and randomly select women ages 30 to 35 for phone interviews to assess inclusion criteria. This will be done until a sample size of about 500 women are obtained. While this random sampling is the best method, there is still a chance that the sample population will not accurately reflect the population frame, as not all women will have completed the census. And another way to find our sampling frame is to use health departments and local gynecological offices to find women ages 30 to 35 to perform the same phone sampling above. And the limitation here, however, is not all women seek routine medical care, so some women may see their primary care provider for their routine gynecological checkups. The quantitative data collection method includes using self-reported surveys to observe changes in menstruation, and the surveys will have closed-ended questions such as, during the COVID-19 pandemic, did you notice changes in your normal menstrual cycle? Yes or no? And there will also be questions that use the Likert scale to quantify the pandemic stress levels. For example, it will ask questions such as rate your stress level during the COVID-19 pandemic. And then it will have the option, was there no change, mild change, moderate change, or severe change? A few confounders could include financial stress, job status, inactivity, and mental and physical health. It is important to note that this is a population-based cohort study, as the population is a representative sample of the entire population. As far as measures of effect in the descriptive analysis of the data, risk difference will be applicable, as there will be a comparison of each individual to themselves pre-pandemic, which is the reason for the required menstruation tracking. The population risk difference will be used to compare the whole sample population during the self-reported population pre-pandemic. Relative risk analysis will tell us how likely or unlikely the menstrual irregularity is during pandemics, while the attributable risk percent will tell the proportion of women with menstrual irregularity attributable to the pandemic. The prospective cohort method allows for high internal validity as it measures in the present, and due to random selection of the sample, there is also a high external validity. The loss of follow-up to attrition or pregnancy, which would exclude some individuals, could be problematic, and recall bias regarding sleep patterns and perceived stress could also be an issue. If the confounders such as inactivity and employment status are existent, it is assumed that they are widespread and equally offset. For those affected by being more inactive, there will be people who adapt more easily by continuing their exercise routine and exercising outdoors or getting at home gym workout utensils, or they have equipment in their homes already. Regarding the employment statuses, essential workers could offset the amount of unemployment that occurs because their statuses are unaffected. The primary qualitative data collection methods include participant diary/notes feature in the menstrual cycle tracking app, and follow up with small online focus groups investigating the myriad symptoms and emotions participants went through. Because of the careful screening and selection of the 500 participants that will provide quantitative data discussed previously, a judgment sample will be selected as a subset from the total. 150 women will be actively selected for qualitative data collection follow-up as a critical case sample, based on their initial responses at the first data collection at 2 months. All 500 women enrolled in the study will utilize the Notes diary feature in the menstrual cycle tracking app. So in this way, the qualitative data will be collected from all of the participants. However, 150 women will be purposefully sampled utilizing the focus groups with a standardized interview guide, which is based off their self-reported symptoms. And women who report having no noticeable changes in their cycle or mood or symptoms or stress will be recruited to participate in focus groups. And women who report noticeable changes to their cycle will also participate in the same manner as will women reporting moderate changes. Following the initial quantitative data collection at the 2-month mark, 150 women will be stratified into the 3 categories depending on their severity of their menstrual cycle symptoms. These women will be grouped into carefully created focus groups that will meet beginning at 3 months and continue meeting at the 6-month, 9-month, and 12-month marks of the study. Each focus group will be audio recorded and held up for 60 minutes while being facilitated by a trained research scientist. Each group will answer up to about 6 questions during their 60 minutes of their recorded interview, and there will be about 150 women total in the focus groups, with 15 groups of 10 women, and then we will break those groups down into smaller groups that are organized by their cycle changes. So we will have 4 groups of 10 with no cycles, 4 groups of 10 with the moderate, and 4 groups of 10 with severe, and 3 groups of 10 with mixed symptoms. So it's from all of the previously mentioned, the no cycle, moderate, and severe changes. The sample interview guide contains open-ended questions aimed at exploring the participants' perceptions of changing life schedules, perceived changes in menstrual regularity, perceive external factors, and perceive stress levels of daily life pre- and post-pandemic, as well as their potential coping mechanisms to combat stress. These questions provide a sample of lead prompts to encourage discussion within each focus group, and the questions are ranked in order of importance for exploration and to help facilitators effectively manage group discussions. More questions are allowed to be explored as time allows. Audio recordings from focus groups will be transcribed for narrative data analyses. Researchers will investigate the emerging patterns and themes, similarities and differences, and develop categories and codes for the descriptive and inferential data analysis. The goal of this analysis is to understand how significant life events, for example, the global pandemic, may influence menstrual cycles. A previous study was performed to correlate the menstrual cycles to BMI, alcohol consumption, and the sedentary lifestyle. It was noted recording menstrual flow and behavioral changes were the main factors that were difficult to validate within the study, indicating that it could be different for each woman. But for our study, the odds ratio could be used to evaluate the menstrual cycle changes in the population, and the relative difference in logistic regression would compare the relationships between the groups. This type of IRB classification would likely be an expedited application, as there are no interventions in the study, but there will be audio recordings of the focus groups or surveys asking invasive questions about female reproductive cycles. In order to get federal support, an IRB that is registered with the Office of Human Research Protection must be selected. Otherwise, an authorization agreement with an organization that has a registered IRB must be attained. And finally, a certificate of confidentiality may be necessary, as the topic of the study could be considered sensitive due to the subject matter being of the female reproductive system. The self-reported surveys are acting as our quantitative instrument we chose, and it's observing the changes in the menstruation among women ages 30 to 35. Our focus groups are the qualitative instrument created to allow for more in-depth research on the women's menstrual patterns. And then for both instruments, we're going to use the Diary cell phone app feature, which will collect the data. The safety and protection of all participants are of the most importance in this study. We will ensure they are informed and we have their informed consent before obtaining personal information, and the participants will be advised that they may withdraw from the study at any time. The information will be collected by a trained researcher, and due to the sensitive topic, the files will be saved on a thumb drive and stored in a locked cabinet/room. And attached, we have the completed Benedictine University informed consent document, which details the general information about the study, procedures that participants can expect to complete, risk and benefit information, and the confidentiality statements. This form provides information to the participant so they can make a decision regarding their enrollment in the study. Thank you.